Hi, my name is Paul McMillin. I served for almost 8 years. Before my deployment in 2004-05, I was in good shape. I was never a fast runner, but I was eventually able to run 2 miles in under 16 minutes. Since then, my lungs have been slowly deteriorating. This is my story. I served in the Army from 2001 to 2008 and deployed to Mosul from 04 to 05. I now work as a critical care registered nurse. After I returned from Mosul, I noticed a very slow but steady decline in my ability to breathe normally. I wrote it off to deconditioning and weight gain. My doctor said I was fine. In 2015, I had a vicious pneumonia. It filled my chest with infected fluid. This thick fluid had to be broken down and removed through a chest tube in the ICU. They drained 5 liters of fluid out of me. I remember doctors outside my room asking why I was so sick. No one had an answer. I asked if my time in Iraq may be contributing to any of this, since soldiers were starting to get sick. No one was willing to consider exposure injuries as having a part in my illness. Less than a week later, the fluid came back. This time, I had a thoracotomy and a decortication, which means a thoracic surgeon cut my chest open and scraped out the inside of it. Afterwards, I started running again and celebrated 10 weeks after surgery with a slow 10-mile run, a very slow 10-mile run. As the years progressed, a simple cold could put me in bed for days. By January of 2018, I started having episodes of gasping. The colds became frequent episodes of bronchitis. These would keep me in bed for days and then do it again all over. I always felt different after surgery, but now I was starting to have trouble doing my job. My coworkers, who are critical care nurses and doctors, were telling me I was pale white. They agreed I was getting worse instead of better. I felt exhausted, and at times I couldn't catch my breath. I wound up in the ER, but my vital signs were fine. Doctors and nurses started treating me like my problems were psychiatric. One emergency room nurse said, "You're an ICU nurse and you're breathing like that. You should be ashamed of yourself." A pulmonary resident noted that my symptoms seemed psychogenic. There was one senior pulmonary doctor who looked over my case and felt my problems might not be psych. He was concerned about my history near burn pits. In the months that followed, I saw many other clinicians. I filled out the VA burn pit registry and saw their practitioners as the registry recommends. They asked a lot of questions, but then they wouldn't answer mine. Since I had no VA benefits, they could not help me. All I could get out of them was I should seek a pulmonary physician as soon as possible. The practitioners seemed genuinely concerned, as if they wanted to say more, but sincerely felt they couldn't. The VA still charged me a copay for this visit. The only diagnosis the civilian physicians here in Columbus made is severe allergies and/or possibly anxiety. But all the tests my doctors performed have been unable to diagnose asthma or anything else for that matter. My outpatient pulmonologist said he was sure it was asthma, even though he couldn't prove it. He wanted me to just take his word for it. Eventually, I learned of a study by a New York doctor, Anthony Sema. Dr. Sema's study described my symptoms perfectly. He diagnosed me with what he calls Iraq-Afghanistan war lung injury, as well as asthma. He then prescribed breathing medicines that have helped me feel more normal and work effectively again. Most Columbus doctors, including my primary care physician, have not been receptive to Dr. Sema's diagnosis. They have made passive or outright dismissive comments towards his diagnosis. They again insist my problem is only asthma and psychiatric. If Dr. Sema is correct, I likely have a disease called constrictive bronchiolitis. This disease has no cure and eventually destroys the lungs. Survival can require a lung transplant. It can only be diagnosed through a surgical biopsy, which Dr. Sema only does for benefit compensation. He hasn't said why, but I suspect it is hard for him to manage the care of soldiers coming from across the country through a hospitalization. I am okay with a singular diagnosis of asthma. I would actually consider that a win. Asthma, although serious, is seldomly life-threatening. My biggest concern with doctors saying my problem is just asthma is that these doctors conclude this without any research into what other veterans of Iraq and Afghanistan are experiencing. They are okay with referencing that vets seem to be having exposure-related breathing problems, but they are unwilling to investigate how diagnosing them has been different from previous cases of bronchiolitis. Veterans with bronchiolitis describe identical treatment from their own clinicians. They have been told that they are just asthmatics with psych issues. This changes only after they have surgical biopsies to confirm that they do in fact have bronchiolitis. So that's my story and how I got here. I'm starting this channel to raise awareness and work to find physicians who can help us. Part of getting physicians on board is showing them there is a need to take this problem seriously. Please share your stories so that we can get the help we need. What stories do you have about how your doctors have told you that your post-deployment breathing problems are psychiatric? I look forward to hearing your stories. Thank you.